Hello everyone. Important neat point of mandibular fracture. Simple fracture includes linear hash of condyle, coronoid ramus and edentulous body of mandible. Compound fracture include fractures of tooth-bearing portions of mandible. Greenstick fracture is a rare type of simple fracture and is found exclusively in children. Comminuted fracture are due to direct violence to mandible from penetrating sharp objects and missiles. The condyle is moved in anterior-medial direction under the influence of lateral pterygoid or external pterygoid muscle. Most common fracture complication in children is ankylosis. To avoid this, early mobilization is indicated in cases of young children. CSF rhinaha is seen in lower 4 to 3 and in cases of severe nasoethmoidal fractures. Risdon wiring is indicated for symphyses when all the teeth are present in the arch. The use of acrylic cap splint with circumferential wiring is the best method to treat mandibular fractures in children. Eburnation is seen in the case of non-union of fracture and the radiographs show rounding off and sclerosis of bone ends. Greenstick fracture is a variant of simple fracture and is found exclusively in children. Damage to the inferior alveolar nerve after fracture results in the paresthesia or anesthesia of the lower lip on the affected side. Although changes in sensation in the lower lip and chin may be related to chin and lip lacerations and blunt trauma, numbness in the distribution of inferior alveolar nerve after trauma is almost pathognomic of a fracture distal to the mandibular foramen. In case of subcondylar fracture in children below 10 years, 1. No immobilization and active treatment is required if the occlusion is undisturbed. 2. If the occlusion is grossly deranged, IMF is indicated for 7 to 10 days with intermittent active mouth openings. Compression plates are used at inferior border of mandible below the inferior dental canal. If there is opening of the upper border, it is necessary to apply a tension band in the form of arch bar or mini plates at the upper border. When compression plates are used, they provide extremely rigid fixation and the bone healing takes place without the formation of intermediate callus. The optimum length of screw for fixation of plate in mandible is 4 mm. In edentulous mandible, the molar areas are weakened following alveolar resorption and become the site for bilateral fracture of edentulous mandible. There is downward and backward movement of anterior part of mandible under the influence of digastric and mylohyoid muscles. Because of sudden change in angulation, angle is considered as weakest part of mandible, angle of mandible most common site of fracture. Fractures of angle of mandible are influenced by the pull of medial pterygoid, masseter and temporalis muscles, which displace the ramus in superior and anterior direction. This is a horizontally unfavorable fracture. Thank you. Please subscribe my YouTube channel.